Good afternoon, guys. Today's topic A is about spotting signs of elder abuse. So here we go with the presentation I made for you. Please enjoy. Here's a clear, grounded explanation of the text, spotting the signs of elder abuse, based primarily on the context of the page you're viewing. What the page is doing. The page from National Institute on Aging is an infographic based public education resource designed to help people quickly understand what elder abuse is, the different forms it can take, and the warning signs that someone may be experiencing harm. It's meant to be a simple visual and shareable, something caregivers, families, and community members can use to stay alert and informed. Key themes emphasized on the page. Elder abuse can happen to anyone. The page opens with a clear statement. Any older adult can be affected. This frames abuse as a widespread, under-recognized issue, rather than something limited to certain families or settings. There are multiple types of elder abuse. While the infograph itself isn't fully displayed on the text, the page explicitly says it covers different types of abuse. These typically include physical abuse, emotional or psychological abuse, neglect, financial exploitation, sexual abuse, abandonment. The page's purpose is to help readers distinguish among these categories and recognize their unique warning signs. Recognize the signs. 3. Recognize the signs is the central goal. The page repeatedly emphasizes spotting the signs, the core message of the infograph. Although the specific 7 signs aren't listed in the text, you can see the surrounding content makes clear that the infograph teaches readers how to identify behavioral changes, physical indicators, environmental red flags, financial irregularities. The goal is early detection so that harm can be addressed quickly. 4. The resource is meant to be shared. The page encourages readers to download the infograph. Share it on social media and use the hashtag NIA Health to connect with others. This signals that the NIA sees elder abuse awareness as a community level issue, not just an individual one. It connects readers to deeper guidance. The page links to related resources, including more detailed information about elder abuse. Guidance for long distance caregiver and tips for talking with a doctor about sensitive issues. This positions the infograph as an entry point into a broader set of tools for safety, communication, and support. How this fits into the broader context of elder safety. The page is part of a larger NIA effort. Normalize conversations about elder abuse, reduce stigma and silence, empower caregivers with practical knowledge, and encourage early intervention. It's intentionally accessible, something a family member, a neighbor, or community volunteer could understand at a glance. Given your work in caregiver education and myth busting, this kind of resource aligns beautifully with your focus on practical human tools, dignity-centered care, and empowering communities with clear, actionable information. If you want, I can help you turn this into a slideshow, slide for a training deck, caregiver handouts, myth busting campaign piece, or culturally adaptive community education script. Okay, guys, now the other piece of this is understanding the signs of elder abuse. It's more than meets the eye. Okay, I'm going to give you some more information about that for people's FYI. Introduces a page that warns readers to slow down, look closer, and recognize that elder abuse is rarely as obvious as a bruise or a shrouded insult. The surrounding content frames abuse as widespread, often hidden, and frequently misunderstood. urging readers to pay attention to the quieter, more ambiguous clues that something is wrong. It emphasizes that protecting older adults requires noticing patterns, not just single events, and understanding that abuse can be woven into everyday interactions, caregiving routines, and financial decisions. Types of abuse on the page highlights the resource under the resource underscores that elder abuse is not one thing, it's a spectrum of harmful behaviors that can appear in different forms depending on the relationship setting and vulnerability of the older adult. It points to or implies several major categories: physical abuse, which may leave visible injuries but can also show chronic pain, fear of touch, or inconsistent explanations of harm. Emotional or psychological abuse, often visible, expressed through uh, humiliation, threats, isolation, or controlling behavior. Sexual abuse, which is deeply underreported and may present through behavioral changes or unexplained physical symptoms. Financial exploitation, one of the most common forms involving misuse of money, property, or legal authority. Neglect, whether intentional or due to caregiver burnout, showing up as unmet basic needs. And abandonment, when a caregiver deserts an older adult who depends on them. By naming these categories, the page helps readers understand that abuse can be covert, relational, and systematic, not just physical. Common warning signs emphasized. The surrounding content highlights a range of observational obser, observable indicators that can help people detect abuse early. Physical signs, unexplained bruises, burns, fractures, repeated ER visits, or injuries that don't match the story given. Behavioral and emotional changes, withdrawal from activities, sudden anxiety, fearlessness around particular person, irritability or confusion that seems out of character. Neglect indicators, poor hygiene, weight loss, dehydration, bed sores, unsafe living conditions, or missed medications and appointments, financial red flags, abrupt changes in banking patterns, unpaid bills, uh, despite adequate funds, missing valuables, new friends involved in finances, or sudden legal documents changes. The page's message is that any one sign may seem small, but together they can reveal a pattern of mistreatments. Why it's often missed. The resource stresses that elder abuse is frequently overlooked because the dynamics are complex. Older adults may fear retaliation or losing the caregiver they rely on, feel ashamed or blame themselves, have cognitive impairment, making it difficult to articulate what's happening, want to protect a family member, even if that person is harming them. Meanwhile, observers may misinterpret signs as just aging, just dementia, or just family conflict. The page encourages readers to challenge these assumptions and recognize that abuse often hides behind silence, dependency, and stigma. What the page tells readers to do. The resource promotes a practical two-step approach. 1. Talk with the older adults gently and privately when it is safe. Ask open-ended questions and listen for inconsistencies or distress. Report concerns to appropriate authorities, adult protective services, a long-term care ombudsman, or law enforcement if there is immediate danger. It also directs readers to additional materials, including downloadables, guides, and related articles to help them take informed action. How this resource helps communities. The page positions itself as a community education tool, something that families, neighbors, volunteers, and professionals can use to build awareness and reduce the silence surrounding elder abuse. Its tone is empowering by learning the signs. Ordinary people can intervene early or prevent harm and support older adults in maintaining dignity and safety. It's designed to be shareable, accessible, actionable, encouraging a culture where people feel responsible for noticing and responding to the well-being of aging adults in their lives. Okay, guys, that is A for you. I'll be back on with B shortly. Give me a bit for that, and I'll be back on with that for you. In a bit, I'm going to take a little break for myself. I'll be back on shortly. For now, Gator Wellness, take care, folks.